Thank you so much for the kind introduction, and thank you for having me today to present my experience in hematopoietic stem cell transplant. So I will start my presentation with a brief introduction to Oman, just to get a sense of our demographics and how our healthcare system works. And then we'll move on to describe our allogeneic stem cell program at Sultan Qaboos University Hospital, and speak on the recent changes in our healthcare system as well. And we will present some data on our transplant program and its performance, and then eventually finish my presentation with some challenges and future directions. So the Sultanate of Oman is one of the Gulf countries with an estimated population of 5.3 million as of Friday, August 23rd, 2024. Our population growth estimated to be 2.5% per year, and we relatively have very young population, with majority of our population falling in the age category between 15 and 64 years. We have only 5% of population who are 50 years and above, and of course this has a major implication in terms of our transplant age and performance. The median age in Oman is 29.5 years. So the healthcare system of Oman is governed by the Ministry of Health. It is government-based healthcare system. We do have private sectors, but the Ministry of Health is a central governing body. We have Sultan Qaboos University Hospital as a leading center in hematology and bone marrow transplant. And we had some changes recently into our healthcare system, where University Medical City was introduced. And this change was basically to allow access between three main centers in the country, including Sultan Qaboos University Hospital, Sultan Qaboos Comprehensive Cancer Care and Research Center, where they treat solid tumors. And in 2023, the opening of National Omani Hematology and Bone Marrow Transplant Center as well moved some of hematology care to that center as well, which I'm going to talk about later in some more details. So the University Medical City now has under its umbrella three major centers, and again, it is still governed by the Ministry of Health. This is Sultan Qaboos University Hospital. For those who haven't visited Oman, it was established in 1986, and it is affiliated with the Sultan Qaboos University, the only public university in Oman. It has grown to become a leading medical center providing comprehensive healthcare services with a mission to deliver high-quality patient care and promote health education and advanced medical research. The hospital has been dedicated to train healthcare professionals in different specialties since its start in 1986. And hematology department within the Sultan Qaboos University Hospital has been known as a national reference center for hematological disorders. We cater different disorders from non-malignant hematology to advanced hematological malignancy services between leukemias, lymphomas, myeloma. And of course, it holds the only transplant center in Oman for allogeneic stem cell transplant at the moment. So the allogeneic stem cell transplant program started in 1995. It started as a single-bed HEPA-filtered unit, and they performed 4 transplants in 1995, a very slow start. They expanded to include 2 beds within the unit, and we currently have 4 beds capacity as of 2024. The current operations of the program, so we have an estimated 25 to 28 allogeneic pediatric and adult stem cell transplants performed per year. Our numbers have expanded in the last 5 years, so I'm going to show in a bit. The autologous stem cell transplant is done outside of the BMT unit, and it's usually performed in single rooms of pediatric and adult hematology wards. So our intake is mainly local transplants that are done at our our local BMT unit, we take referrals for allogeneic stem cell transplant from all over the Sultanate of Oman. However, I think it goes without saying we are limited in terms of our numbers of beds with only 4 beds unit. We cannot offer transplant to our acute leukemias, especially in timely manner. And here where treatment abroad pathway comes, which is fully covered government referrals to get transplant abroad. And this has been actually a great help, offering timely manner facilitated transplant for urgent cases that cannot wait for a bed availability at our local unit. Once patients finish their transplants and come back to Oman, we resume their care. Usually they are sent back to Oman between day 40 plus or day 100 post-transplant, depending on the center that they received the allogeneic stem cell transplant at. So as of February 2024, we have performed 719 transplants in total, 619 cases of allogeneic stem cell transplant. Those are the numbers performed locally, not to add any, not to confuse you with the treatment abroad pathway. These are all local transplants. We have performed 100 cases of autologous stem cell transplant at Sultan Qaboos University Hospital. And with respect to fractionation, as you can see, 81% of these are allogenic and 19% are autologous. This is the distribution as of 2017. Again, almost 80% allogenic, and auto accounts for 19 to 20% of all our cases. I have run more of data analysis just recently, just to see if our estimation and our fractionation are still the same. We are actually still at 81% of all cases allogenic and 19% autologous stem cell transplants. Our numbers have increased as the unit started in 1995. As I mentioned before, we have only 4 transplants performed that year, but we did have a growth year by year, approaching almost 52 transplants in 2022. So you can see that there is a steady increase in numbers between 2014 to 2022, and this all comes to how effective turnover between between the beds and how effectively we are using our 4 beds unit. When it comes to donors, we are lucky that we have a huge pool of matched sibling donors. I mean, the majority are coming from matched sibling donors, which account for 83% of all transplants performed. 15% of our transplants are haploidentical, and we do at some occasions perform match-related donor transplants. With respect to indications, malignancies constitute the almost 50%, which is the half of our indications for transplant, i.e. acute leukemias. We do perform transplants for primary immunodeficiency, bone marrow failure disorders, which constituted 29% of our total transplants, and hemoglobinopathies constituted 23% of our total transplants. That being said, this data is a bit old, going back to 2017, and yet we have to do a new run analysis of our indications and see if these proportions are still holding. This is just a fraction again of our indications, where inherited disorders, being frequently transplanted along with hematological malignancies. Under non-malignant indications, we have transplanted variable diseases. As example is HLA class 2 deficiency, interferon gamma receptor deficiency, severe combined immunodeficiency syndrome, HLH, Fanconi's, Glanzmann thrombocythemia, and CGD as well. And I have, again, done some analysis on our cases in 2024. You can see the total number of AML cases were 114 so far. We have transplanted 90 cases of sickle cell disease patients locally and 83 thalassemia patients locally as well. The rest are just small numbers, but these are the highest numbers we have transplanted in our unit so far. I think when it comes to sickle cell and thalassemia experience, those are not small numbers for a population of 5 million. And I think it is worth getting more detailed analysis of these patients in terms of their outcomes, conditioning regimen, stem cell source, and share our experience when it comes to sickle cell disease and thalassemia specifically. As I mentioned, our population is relatively young, and it's not surprising that most of our transplants are between pediatric up to age of 40, and we have less patients getting allogeneic stem cell transplant at an older age. Just knowing our population is relatively young, and we have only 5% of patients who are 65 years and above. Stem cell source by far is peripheral stem cell, which is mostly the current practice right now. We are still going for bone marrow harvest when indicated, especially for bone marrow failure syndromes, aplastic anemias, thalassemia, for example, immunodeficiency. So that is still ongoing, especially among pediatric age group. We have recently looked at our acute leukemias, how they have done in the last 5 years, and our main question in this paper was basically to look at the impact of COVID-19 pandemic on our outcomes. But I was able to get our transplant data from this paper and just to show the rates of transplants for acute leukemias in the last 5 years. So in this paper that was recently published, we included patients who are diagnosed with acute leukemias, either AML or ALL, between January 2017 and December 2021. We identified 493 patients and included only 13 years and above. I don't know how it works here in Saudi Arabia, but in Oman, anyone who is 13 years and above is treated as an adult, and they are under adult care. So those patients who met the criteria newly diagnosed in this time frame were included in the study. We did exclude a large number of patients, to say the least, and that's not surprising, knowing that some patients are being sent abroad for transplant, and we don't have information on their outcomes. So that led to some exclusion. We included 151 cases, and as expected for adult population, the AML by far is more common than ALL cases. And I mean, when you look at our numbers are not small. And this is just a single center experience. We are currently, based on the study, getting almost 100 cases of acute leukemias per year. And that's not a small number for a single center. When we go to the details about transplant rates, so before COVID-19 pandemic, i.e. before 2019, 39% of patients received allogeneic stem cell transplant for ALL. And after 2019, 30% received allogeneic stem cell transplant for ALL. When it comes to AML, the rates of transplant are higher, understandable, approaching 48% and 52%. So the rates of transplants remain the same. It's fair to say that our rates of transplant for AML comes to close to 50%, like 50% of patients will go to receive allogeneic stem cell transplant. Estimated or probability of survival at 1 year was estimated 70.6% before COVID-19 pandemic and 83% during COVID-19 pandemic. Though the numbers look significant, it was not statistically significant, but this is just to shed light on overall outcomes for these patients. We have huge laboratory support when it comes to T-cell depletion, graft manipulation, busulfan pharmacokinetics. Everything is done locally. We also have in-house blood bank at Sultan Qaboos University Hospital, in addition to getting a direct access from a central blood bank in Oman as well in cases of any shortage. TBI access was a challenge for us. So we did have TBI access through the Royal Hospital back in 2010 up to 2014. Unfortunately, that access was lost when the Medical Oncology Service moved to Sultan Qaboos Comprehensive Cancer Center. But we were able to reestablish that connection. In May 2023, we did the first adult patient with receiving myeloablative TBI in a 13-year-old female with mixed phenotype acute leukemia. We have recently done, I think just to commend their expertise, they have taken a patient with a BMI of 61 to receive TBI, and it went so smoothly without any limitations. And just a few weeks ago, we were able to do the first case of pediatrics receiving myeloablative conditioning as well, and that connection was established. This is a major milestone for us because prior to this, we were sending patients with ALL to receive allogeneic stem cell transplant abroad because of TBI access, even if we had a bed for them. So this is for sure is a game changer. We are accredited. We hold accreditation by Accreditation Canada International, and we are also a member of EBMT. I think this is the highlight of my talk today, the National Omani Center for Hematology and Bone Marrow Transplant. It was opened in 2023. This is a dedicated hematology and bone marrow transplant center. We are currently operating at the outpatient setting, including daycare unit and specialized clinics. Our daycare unit includes 24 adult beds and 18 pediatrics with really very high turnover, i.e. our service run from 7:30 in the morning until 8 p.m. So we are actually able to accommodate sometimes 1.5 double the bed capacity and serve patients smoothly. We have specialized clinics as well, which I'm not going to get into for the focus and the sake of the time. Our inpatient units will start very soon. We are hopefully ready for prime time by October or November this year. And our inpatient unit will include 48 beds unit, in addition to dedicated BMT unit, which hold the capacity of 22 beds, in addition to 4 ICU beds within the same floor. So at the outpatient setting right now, we are running BMT clinics. We have 3 specialized clinics, early follow-up clinic, chronic GVHD clinic, and long-term follow-up clinic that are run weekly. We have daycare unit that provides access to supportive care, especially in the first 100 days post-transplant, mainly for hydration, transfusion support, and magnesium replacement, and monitoring their cyclospore and aortic tacrolimus levels. Royal Hospital is under the umbrella of Ministry of Health. It is another center that is currently performing autologous stem cell transplant. They have started their program back in 2014, and they are performing autologous stem cell transplant only at the moment. Their transplant numbers up to 2016 were 29. Unfortunately, I don't have access to their most recent data, but they have an estimated annual transplants of 10 per year. They also hold accreditation by Accreditation Canada International. Just to touch base on our outcomes briefly, when it comes to graft versus host disease, we have an estimated rate of acute GVHD of 32%, which is similar what is reported in the literature. Chronic GVHD rate estimated to be 10 to 15%. And again, unfortunately, I don't have any recent data on our GVHD rates, and it will be interesting to see how ATG in a matched sibling donor played a role in our rates, and if these numbers, in fact, are lower than what is reported before. ECB for GVHD was established in January 2023. Again, prior to this, we were sending patients to get access to ECB for chronic GVHD, mainly abroad, where they stay there for months to receive treatment. This was not practical and not really cost effective. So having the ECB in-house now has not only improved patient care, but also lowered the cost of sending patients abroad for such treatment. We have monitored quality of life outcomes in sickle cell disease patients, and I can confirm that they are really doing well. The GVHD rate in general, acute and chronic, reported by patients to be 38.5%, and they have good quality of life post-transplant. We do have challenges. I think it goes without saying that our main limitation is having really limited bed capacity of 4 beds to serve 5 million population. But now, with the infrastructure being expanded and having 22 units, between 22 bed unit in-house, will hopefully solve this problem very soon. And that's why I had left it to the end. I'm being very optimistic about the near future. Donor availability is going to be a problem for us soon. we do have, high probability of having a matched sibling donor for our patients. But as our society structure and demographics changing, having limited and smaller families, I think we will be forced into using either matched related, or haploidentical transplants soon. And that's why we will need to have a very robust donor registry. Of course, complications will remain a challenge, and something to focus on for any transplant center in terms of GVHD rates, infections, and disease relapse. This is just an example of our waiting list. We literally have 268 patients waiting, and that goes to December 5, 2023. And I can tell you, most of these patients are actually sickle cell disease patients waiting to get a transplant, mostly locally. We do send patients abroad, but for sickle cell disease patients who can wait, we are trying to accommodate them locally. So we are hoping that in 2 to 3 years we'll be able to get to this list and complete it hopefully in no time. Our future directions mainly focusing on expanding infrastructure, donor registry initiatives, and continuing in research and having very robust database would actually help into monitoring our outcomes as we are expanding. And of course, looking always for regional and international collaborations. In summary, I think it is fair to say, despite having a small program, our data have shown that Oman has a viable and successful hematopoietic stem cell transplant program. And we have established the milestones to continue on and expand on what we have right now. We have performed over 700 transplants in both malignant and non-malignant hematology diseases. And 20 years of experience in transplant is not small. I think we are set up for prime time in no time, inshallah. And hopefully we'll meet in a few years to present our changing numbers. Thank you so much.